Growing up, I knew my parents were there for me. We celebrated family events. They were there for me when I was sick or needed help. As me and my sister grew up, we knew we could count on our parents. We were so proud to be their children. Today, we are there for our parents, to share in the celebration of their grandchildren or to be there when they are ill or need assistance. They can count on us. And now our parents look to us to take care of them. Welcome to Always There. I'm Michael Wilsker and I'll be your host. I am an owner of an elder care company called Always Best Care Senior Services. We provide in-home non-medical care for seniors and free placement for assisted living and independent living. The show will deal with issues that families face when it comes to the elderly. And I'm very happy to have as my guest today David Nelson. And the topic we're going to be discussing today is age and place technology. Welcome, David.
Thanks, Michael.
Please tell the audience exactly what you do and
Sure.
and your background,
Yeah.
so that they get a feel for what we're going to be talking about today.
Okay. Well, first, thanks for having me on. It's a pleasure to be here. And so my company is called Qmedic. I'm one of the founders of Qmedic, and we do smart medical alert products. So you're probably familiar with products like I've fallen and I can't get up. That was made popular in the 80s. Those are products where seniors wear a wristband, and this wristband has a button that they can press. And the button will allow them to get help in an emergency. And so we make a smart version of that, basically a technology-enabled version which has sensors that allows the user to get help even when they can't press the button. And it tracks different elements of their well-being so their family knows that they're okay. And so the way I got into it, I started out in finance after my undergraduate degree.
And where did you go to school?
At Michigan, University of Michigan.
Oh, Michigan, a
Yep.
Wolverine.
Wolverine,
Okay.
yep.
I have a very
Go
good
blue.
friend of mine whose daughter just got admitted to Maryland.
Yeah,
And Maryland is now in the Big Ten.
that's right,
And
yeah.
my best friend
It's our
went
rival
there,
now.
and now it's the Terps against the Wolverines.
Terps and the Wolverines, that's right. So yeah, I went to Michigan and went into finance after that. And after 4 or 5 years in finance, I realized I wanted to make more of an impact, and I wanted to see how I could help people more. So I went back to get a master's degree in business from MIT and got into kind of technology entrepreneurship there. A lot of innovation obviously happening there, and met up with some people that were working on sensors and how people could wear sensors and it could help them with their health. And I got really excited about that. I've always wanted to use technology in ways that can help people. So we started the company 2.5 years ago with people that I met at MIT, and we've initially focused on using sensing for fitness applications. We then moved into other physical activity and were funded by the National Cancer Institute to do some work around physical activity detection for large studies. And more recently, in the last year, we've really been focusing on, as you mentioned, the aging in place marketplace. And the real opportunity is taking devices, these medical alert devices, which 2 million Americans are already wearing, and finding a way to make those smarter so that they're not only helping people when they actually have an emergency, but helping to prevent emergencies from ever happening. So making sure those people are well and they're living safely in their home.
Now, how do you market that? How do you get the interest? Yeah. How do you get your customers or the families interested?
Yeah, so we work with a lot of partners that are in the healthcare field. So this is a product that's usually purchased by a family for their loved one when there's some health event or some decline in their health situation. So in that case, there's a lot of other people in the kind of health world that are involved in that situation. So in-home care companies, discharge planners, independent living facilities, all of these folks who are there to help can refer people to us, and then we can bring this service to the senior. They can also find us online, and we do sell direct to the consumer through our website.
And your main competition is Lifeline,
Absolutely.
Philips?
Philips Lifeline.
Right.
They've been in the industry for many, many years, pretty close to here, actually, in Framingham. That's where they're headquartered. The great company, really good company. And they've were recently actually acquired by Philips. They started as Lifeline in the late 70s and were recently acquired by Philips. And Philips is bringing a lot of new technology to this product and to
When,
this
we,
industry.
when were you acquired by Philips?
No, I'm sorry. The Lifeline was acquired by
Oh,
Philips.
Okay,
Yeah.
Okay.
So it started as Lifeline.
I'm sorry.
No, it's okay. And then it was acquired by Philips, and they're a great company. They're the big dog in this industry, and they've done a lot of great things for people.
Now, I've been reading a lot of articles. I read an article in the New York Times, the Los Angeles Times, that there are a number of companies that are out there now.
Yeah.
Are they all different areas of technology, or
Yeah.
are they pretty much the competition that you would be involved with?
Yeah, there's a lot of different things that are coming out now, and it's really driven by, smartphones is a big issue because the technology is becoming much cheaper because of all the small electronics going into smartphones. The battery power is becoming much better. So it's opening up these opportunities to put technology into different places. And you see a lot of trends in medical alerts, which is where we are. Generally home-based monitoring. So these are products that can be placed in the home. They're sensors that can be placed in the senior's home and detect different elements of their daily activity. So maybe on their coffee pot to know that, hey, mom used the coffee pot this morning. I like to know that, so she's okay. Maybe on the chair, so we know how much time she's sitting in the chair. Maybe she should be getting up and moving more. So you have those types of products. You have GPS-enabled products for Alzheimer's. That's a big issue, is wandering. You want to prevent someone from leaving their home. So you have GPS, or what you call geofencing products that use the cellular network to identify where the person is and make sure that they haven't wandered from where they're supposed to be, and alert the family if so.
So where are these sensors placed? Because obviously it's the Alzheimer's, the person who has Alzheimer's is not going to be the one that switches them on and switches
Sure.
them on. Are they on all
Yeah.
the time? Where are they located?
Well, there's one now that's embedded in the shoe. So the person could wear a shoe that has a GPS tracking device, and they can have it with them all the time that way. They don't even have to think about it. And it's always on, it's always tracking. So there's a lot of innovative things that are happening. There are also wrist-worn devices for Alzheimer's that do your GPS tracking from the wrist. But people are coming up with a lot of these new innovative ideas, and it's driven by the electronics and the availability and the price that you can get these at now. So you're starting to see them go out in a lot of different areas now.
Now, who does the monitoring of these devices?
Yeah,
Are
great
these
question.
professionals? Are these just people that are trained to, like, the security companies? Are the same kind of people?
Yeah, absolutely. So the industry actually started out of the security world. So back in the 70s when it started, you had, that's where it was, the security. And so most of the people are still using kind of security professionals to do their monitoring. And there's these monitoring stations that are very sophisticated in the sense that they have redundancy in how they get their power, and they have multiple centers around the country so that they're always available. That's a big key, is that if your loved one's wearing one of these devices, you want to make sure that their monitoring is always available. But now you're seeing it moving from security more towards health. So you're having more that are EMTs or nurses even that are monitoring these devices, and you're getting more services that are kind of nurse call button type systems. So we're seeing it move from the security industry more into the health world now, which is a great thing, I think.
Now, are there? I know we talked about Philips before, but are there other big companies that provide these types of technology as well, or are they all small companies with little niches?
Well, there are
Or is
other
it
big
all
ones.
them out?
So the big ones that people have probably seen, Lifeline, Philips Lifeline. Life Alert is a big company. So they're the ones who actually came up with the I've Fallen and I Can't Get Up commercial that you've probably seen before.
Right.
And they're on the West Coast. There's a company called Connect America, which is very big.
And they all produce the same kind of products as Philips, or the same, but just different types.
Just different.
Or?
Well, it's mostly the standard product is a button that you can press when you need help, and that's what most of these people are providing.
And then around the neck they have the.
They're around the neck. Then the new one that Philips has a couple new ones, and that people should know about. One is called an auto alert. So what that means is it's worn around the neck. It's a button you can press if you ever have an emergency, but it can also detect if there's a fall. So a lot of people are worried about, what happens if mom falls and becomes unconscious. How do we get her help? And the Philips device can actually detect a fall and send an alert out. And what happens is then the responder, the person monitoring at the monitoring station, comes over the line and just asks, "Are you okay?" So that there is some false alarms that happen, but it's always easily addressed by this person coming over the speaker and saying, "Are you okay?" And if so, then that's fine. If not, we're going to get you help. So that's the Philips device. They're also launching a new one now that is mobile. So the traditional product works only in the home. So when you're in the home, you can press the button and you can get help. Now companies like Philips are starting to offer a mobile product, which means you could take it outside of your home, anywhere you are. You're in the grocery store, let's say, and you have an emergency. You press the button, and the emergency service can find you using GPS. So you don't have to be in your home anymore. So really, this is about expanding the market and helping more people, people that are maybe at the younger age levels that are more mobile, but still need this service. That's part of the value that Philips is adding.
Well, these products are only as good if they're used.
Absolutely.
And is that an issue where a lot of elders have these products, but they refuse to use them, or they forget to use them?
Yes.
Is there technology now that will remind them to
Yes.
to turn on their the technology?
Yeah, that's a great point. There's actually a study that was done that showed that people that have these devices, they did a study and said 85% of people aren't wearing them consistently, actually. So that means they have the service, they have the product, and for whatever reason, they're just not wearing it throughout the day. And we think there are a few reasons for that. One, people don't want to wear a device that kind of screams, "I'm old." It does. It's a medical.
It's like a hearing aid.
Yeah, it's a medical looking device, and a lot of people that we talk to say, I don't need that. Even if they're maybe 92 years old, they say, I know a 97-year-old that would be great for that. So, yeah. So to your question, there is a problem with people having these and not wearing them. And one of the things that our solution actually does is it detects if they're wearing it, so the family can get an update if they forget. A lot of people are forgetful, and you take it off and you forget to put it back on, and so we can send out an alert in that case. There's also a challenge with when someone actually experiences an emergency or like a fall, getting them to actually press the button. You'd be surprised that a lot of people don't actually do that, and a lot of the times it's an embarrassment issue. You don't necessarily want to be the person that in your neighborhood that has the fire trucks showing up, and so even if you have that emergency, you think I can deal with it myself. I don't need it. But I just encourage everyone out there that has that service, go ahead and press the button, because they're not going to send the police right away. They're not going to send an ambulance right away. They're going to assess the situation. That's what the monitoring station's for, and then they're going to decide, do we need to send somebody out? So don't feel nervous about pressing that button if you need to.
But then I can see the pushing the button, and the monitoring people call and say, how are you doing? And they say, oh, I'm fine, don't worry about it.
Yeah.
And they've had a serious fall, and they just don't want to have anybody come.
You're right. Well, and also a lot of people are worried that if they have a fall, then their family is going to say, okay, well, we need to make it some kind of serious change in your living situation. So all this goes to what I think this really should move to, and what we're trying to move it to, is how do we keep people living in their home, and how do we prevent a fall? So moving these devices, from security more towards health. So, detecting abnormal behaviors that might be a sign of decline that says, hey, we need to bring somebody in and help this person. They're not getting enough physical activity. That's a huge risk for fall. It's kind of a use it or lose it. If you don't stay active, you have a more of a chance to fall. So these are the types of things that we think are really exciting in this space, is that, how do we prevent things rather than react to them? And that's what we're trying to do.
Well, you could say before that you were promoting what Philips does and the other companies do, but I know you have a couple of products that you brought with you, so why don't you show the audience and...
Yeah, so this is our basic product. So this is a wearable that is a button, and similar to the other ones, and you press the button and you get help. Now, what we have is coming out soon is the advanced product, and that is a product that has a sensor built in, which allows the family, has a mobile app on iPhone or Android, to be able to see any abnormal behavior. So what that means is we're tracking physical activity, we're tracking sleep, we're tracking time in and out of the home, and we're looking for periods that are abnormal. And that way you can alert even if the person doesn't press the button. So one scenario is, mom wakes up at 6 every morning, and we start to see these patterns. This is what we're able to detect patterns. And if mom doesn't wake up until 7, if we don't see movement until 7, then we send an alert, or 7:30 we send an alert. And that allows us to go a step beyond what the existing products are doing. And then we're working with other providers and providing them information that can help them serve these people better. So in-home care or rehabilitation services, they want to know how much activity the person's getting, because that's a big part of your wellness.
Right.
And so we can provide that information because our sensors are able to detect physical activity. So that's kind of what the new product that we're coming out with is doing. And we're excited to see, as we collect more data and we see these patterns, how can we move towards a preventative model rather than a reactionary model?
Now, the companies have a monitoring system. Does the family get involved in that monitoring system? And when there is a call, or the people that are monitoring detect that there's an issue, do they then get the family involved, like the children?
Yeah.
Or do the children get the same information as the people that are monitoring it, so that they're right up?
That's the direction
what's
it's
going on?
moving.
Okay.
The direction it's moving is that the family is right along with them. And for example, in ours, if the button's pressed, you're going to get an alert on your phone, so you know that this button has been pressed. What happens now is with the monitoring stations, when the button is pressed, you're going to get the monitoring person come on the line with you, and they're going to ask you, "Are you okay?" And they're going to say, what would you like me to do, basically? I can call 911, I can call one of your family members. I have a list
Right.
of all of your family contacts.
Right.
So that could be an option for the person who's had an emergency. I just want you to call, my son and have him come over and help me out. So there is that level of customization of where you can say, here's who I'd like to have called in this kind of emergency situation. So the family is getting a lot of information. Now, the opportunity is to provide an even better connection so that the family is getting this information throughout the day on how the person's doing. And that's through things like mobile apps, like I mentioned. You can provide a ton of information, and that's where it's moving.
And who's the one who usually is interested in the devices? Is the family talking to their parents? Is the parents looking at a commercial on TV or hearing that their neighbor next door has it?
Yep.
Gee, I should get one now because everyone else has one.
Yep.
Where did most of the interest come from?
It comes mostly from the family, and the way it typically works is, like I mentioned before, there's a change in the health condition of the person, and it's usually a discussion between the family and the senior. Here are our options, and the senior, as most people, 90% in fact, want to stay in their home, and that's we see that all the time. And in order to do that, a lot of times the family says, okay, you can stay in the home, but we need to give you some things that are going to make sure you're okay. And usually it's kind of a negotiation in that way, because there is some resistance amongst the senior, and as I mentioned, that you don't want to admit in some cases, none of us
Right.
do, that we
Right.
need something like that. And that's why there's a lot of things that companies like ours or others can do to make it better, to make these more attractive devices, to provide more value to the senior. Not just we'll help you if there's an emergency, but we'll help you stay well in your home. So yeah, it is usually the family that initiates it, and they're usually the payer as well.
Now, you brought another product
Yeah.
in with you. Do you care to show that to the viewers?
Yeah, so this is, these products can be on the wrist or around the neck. This is one around the neck. And the nice things about the ones around the neck, actually, this is where you can start to do the detecting of falls. And this is where the Philips product comes in and does fall detection from the neck. This is our product. Again, it's just a typical button. The one that we have that does the advanced analysis is on the wrist. But this one is some people prefer around the neck, and some people prefer around the wrist. It's nice to have both options, and you can choose whichever one fits your lifestyle better. different people like different things.
Now, what are these products? What do they go for? What are
Sure.
What do people have to pay to?
Yeah, so
buy them?
the typical model is a leasing model. So typically the user isn't buying the product. Actually, they're kind of leasing it over a time period, and so there's often not even an upfront charge. You can get this service started without paying anything. Sometimes you have to pay $50 to $100 to get started, and different companies offer contracts. So you have to stay for 1 year or 2 years or 3 years, but it's moving to month, and the month to month payment is for the monitoring, and that's your lease payment, and it's typically in the $30 to $50 range. So $30 to $50 a month, not much upfront. Sometimes 50 to 100.
Now, we talked about a lot of the upsides.
Sure.
What about the downsides? It would seem to me that there would be a cause for concern where a elder living at home, especially by themselves, would become isolated.
Sure.
Wouldn't they don't really try to go involve themselves in the neighborhood.
Sure.
They don't want to go out. They don't have to go out because they have these sensors in their house.
Yep.
How do you address that?
Yeah, and actually that's one of the things that we're tracking is how much time they're going outside, because it's important. Like you said, it's a huge part of your wellness is being involved and staying connected to people. And so our feeling is there is a risk of that, and the answer is technology is only part of the solution. And we all use technology in different parts of our lives, but it's not the end-all solution. It's just a tool that we use to make us more productive or healthy or whatnot. So it has to go hand in hand with people that are involved, organizations, in-home care agencies, and there's an ability to kind of complement each other and use these both as a way to help the person. And that's certainly what we're doing. And the other big concern, and we hear this a lot, is kind of the big brother concern.
I was going to say that.
Yeah.
Right.
So people worry that, okay, I'm being tracked all the time, and do I want to be tracked all the time? And we think of it as, what value are you getting from that tracking? No one wants to be tracked, without getting any value in return. And if you're able to be tracked and actually get some benefit out of it, then you're usually okay with it. And if someone has private information, the example I think of is, I'll give my credit card number over the phone to somebody because I get a value out of that. I can call and order a product and I can have it sent.
Right.
Now, I'm giving up private information, but I'm getting something in return. So as long as there's a good trade-off and you're getting something back, then we think people will be okay with this, and that's kind of our feeling on it.
Well, it's interesting because I'm a baby boomer, and when I was growing up, my parents weren't able to track me. Things were different in those days.
Yeah.
If I was away for a while, I'd call in.
Yeah.
My parents wouldn't constantly say, call in all the time. That's the way it was. That's the way the world worked. Now, you have cell phones that track the kids. The kids don't want to be tracked.
No.
So the baby boomers are going to probably be okay as they get old because they may be more resistant. It depends, I would say.
Yeah. It's hard to say. I mean, the baby boomers are independent, and that's the challenge, right? Is how do you show someone that this is actually empowering you? It's not something that's restricting you or tracking you, and that's the whole challenge of this whole industry, because people buy into things that give them freedom and they can aspire to do more, and that's really where you want to be. And if you can do that, then they won't worry about this tracking element.
Now, I'm in the caregiving business. That's what I do. I have an agency that provides in-home care. And do you see this as supplementing caregiving, or do you see it as entirely replacing caregiving, or it depends on the situation, I suppose?
Yeah, I see it as a complement, absolutely. And we work with in-home care agencies quite closely because, we're tracking things that you can't see, and people have a hard time. If a person's in the home and trying to detect how much activity the person's getting, they have a lot of other things to do, the in-home care providers. So we can provide a value that adds on top. I mean, there's no way that we can replace the human interaction, and we understand that, and that's not our goal. But we can add something where we can provide some information about wellness that maybe is harder for someone in person to track. So it's got to be both, as I mentioned, and so we don't see it as a replacement in any way.
Now, we talked earlier about how much these products cost.
Yeah.
And if you don't have the funds to pay for this for private funds, I'm assuming does long-term care insurance cover this?
Yeah.
Health insurance, Medicare, Medicaid?
Yeah, long-term care insurance does cover it in a lot of cases, and Medicaid is also, in certain states, is covering it. And Medicare does not cover it at this point, and most other insurance products don't cover it, health insurance. But there's a movement in covering a lot of these things. There's certainly a need in the whole country, we're seeing it, for cost-effective solutions, keeping people out of the hospital and treating them in their homes where it's much more cost-effective.
Preventive, right.
And so there's a movement in this way, and I think it's gonna happen in the future. Unfortunately, I can't tell people that it's covered right now, but there's a lot of activity in that area, and I think it's going to be in the future.
So just talk a little bit about what's the Rolls-Royce of this technology?
Absolutely. Yeah, the Rolls-Royce is the person's able to live where they want to live. The person, whoever it is, it's you or me, we're able to get wellness tracking and preventative medicine basically wherever we are. And so we live our day throughout our lives, and we don't even know. And this is able to track to make sure that we're okay. And it's detecting different abnormalities that might come up. So early warning signs for different diseases, being able to see a sign of decline for an elderly person in their home, and allowing us to get help before we hit that real emergency or real huge medical event. So that is the real pie in the sky, what everyone's shooting for. And if that's the case, then I think everyone would value that. It's not tracking, as I mentioned, anymore. It's a real value to you that I'm able to, I'm going to get help when I need it. I'm going to be able to know that I'm declining. And so that's the kind of goal that all of these technologies have.
Well, we're running short on time, and you've, I think, given us viewers a lot of things to think about and provided them with a lot of information. And I have a mother down in Florida who uses Philips, and we're up here in New England, so that is very helpful to us. So you're doing the right thing, and you're going in the right direction, especially since the population, 10,000 elders, 10,000 people turn 65 every day.
Absolutely.
So there's going to be a strong need for that in this situation.
Yep.
So we're going to wrap it up. David, thanks for coming.
Thanks, Michael.
If anybody has any questions, needs further information, they can contact me at alwaysthere@westborotv.org. I want to thank you for joining us today, and I look forward to seeing you on our next program.